What is going on, everybody? For some reason, this is not posting to the Facebook group, but that's okay. I'll just repost it there afterward. And I want to thank you for taking a few moments joining me in the quick live uh, video today because I wanted to talk a little bit about some resources that you get during your EMT classes and your paramedic classes that I think can help you. Now, do me a favor, be sure to hit the like button for me. And even just if you're in Facebook or YouTube, just hit a comment, just say hello in the comments so I know you're watching and I know that you're here with me, checking some of this stuff out. And so I was thinking about um, handouts in class. I know back in paramedic school, EMT school, you get so many handouts, right, for all your classes and lectures, even course outlines that you might get. And I think that a lot of people don't utilize them to their advantage. So I know when I taught classes, I would give them out and just sort of something to uh, 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 give sort of an in between that PowerPoint presentation where the students would kind of just sit there and like, oh, go ahead and entertain me, monkey, right? And the other thing that I think helps students and that you should be using them as is to prevent you from sitting there and thinking you have to write down everything that the instructor is putting out on the board or that they're saying to you. Okay. So use them to learn in class so you can kind of see the highlights of what the handout is and try to take your notes in the sections of the handout that the instructor is talking about. And this goes also hand in hand even when you talk about taking continuing education classes. Let's say you're already an EMT, already a paramedic, and you're out there taking your continuing ed classes, right? Rather than sit there, a lot of these continuing ed classes will give you handouts to use. So when you get them, use them to write down notes during the presentation. All right. This is going to help you because when you go back to study, you'll see the key points that you wrote down. And it's going to help you sort of stay on track as you're studying and you're reviewing. What were the key moments and the key highlights that either the instructor talked about because you noted it in the handout, and what were the key things that the handout covered that you needed to pay more attention to? All right. A lot of times a handout is given to you because these are the things and the high points that they want you to kind of focus on in your class. Yes, you're responsible for everything, right? When it comes to your NREMT test or your final exam, your state exam, yeah, you're responsible for everything. But I think that if you focus on a lot of the key things that handouts have and course outlines have, that is going to give you a pretty good foundation of everything that you need to know. In addition, one thing that I've done when I've given out handouts is I've added sort of resources at the end of it. Okay. Now, don't forget, hit that like button for me. Let me know you're here watching. Just say hi in the comments so I see your name even that you're watching. That's pretty cool too. So, all right, the resource area. What I try to do, and I've seen instructors do this too. Good instructors do this. And if you're an instructor and you're watching this and you're not doing it, think about this for a second. I think this can help you when you're giving it to your students. I would put resources for them to look at after class if they wanted to delve a little deeper into the topic that I was talking about. And also, I put resources there because sometimes, and I'm sure you've encountered this, that when you have or lecture and you're doing a big presentation, all right, you're sitting in a big presentation, if the instructor doesn't get to everything because time is limited, let's say in the class, having those resource notes at the end of the handout gives you a chance to go back and say, okay, the instructor didn't cover it all, but I went ahead and now I can look at all the resources that they provided to get things that they didn't cover during the lecture. All right. So those resources that you might list or you might see at the bottom of the handout, it's kind of twofold on how to use them. One is to give you a reference to go delve deeper into the topic. And the other one is, well, we didn't get to everything. So here is the resource. You can go check it out and finish up what we didn't get to during the class, right? Because sometimes the lectures and the classes, whether it's a continuing ed class, it's something for your exam or your actual course itself, right? Time limit. You get an hour and a half, 2 hours, and the instructor doesn't get to everything because questions get asked. You take breaks, and people come back from breaks and they lollygag in, and it's not everyone there, so they wait for everyone to get into the class. So time starts to stretch. You don't get to everything. So if you can put those resources at the bottom of the handout, right, then students can go ahead and do that. So if you're a student and you see that, don't blow off the resources as something like, oh, it's just a little kind of side thing. I don't have to worry about that. No, take a minute, go check it out, because it might not only help you delve a little deeper into the topic, but at the same time, it might kind of connect dots for you and solidify what you learned during the lecture. Guys, I'm going to end it there. Hope this kind of makes sense for you a little bit, and that you look at those handouts and those course outlines that you get a little bit better, so that when you're studying, you're reviewing, and you're preparing for the lectures, you will be more prepared. Okay. All right, guys, that's it for me. Please hit the like button. Leave me a comment in the comments. Oh, yeah, go check out emscalls.com. Get yourself a free download. I have this free guide. It's called The Patient Didn't Read the Textbook. And it gives you sort of a differential diagnosis of calls that you will go on in EMS, and kind of give you an idea of other things that you can think about when the call type is A and it might be something else. For instance, asthma, everything that they call for, difficulty breathers, aren't always asthma. There's a lot of other things it can be on a difficulty breathing call. Chest pain isn't always a heart attack. A lot of other things that it can be, and some things you can think about when you are getting on these calls. So go check that out, guys. It's 100% free at emscalls.com. All right, that's it, guys. That's it for me. As always, Jim Hoffman from paramedic EMS SEO. Stay safe. Let me end this, baby.